Welcome to another session of Understanding Human Anatomy. This will be the second video on the upper extremity, and in this video we're going to be talking about the second bone of the pectoral girdle, the scapula or shoulder blade. Now I'm going to show you how to sketch a drawing of the scapula, and I'm going to do this in stages, and I'm going to be modifying the drawing as I go, which means I'm going to be making changes in it and doing some erasure. I highly encourage you to follow along with me with these drawings with a piece of pencil and paper, because by drawing the bone you'll get a much better understanding of what the bone is like, what its structures are like. And if you're a kinesthetic learner, it will be the most beneficial. Now, the scapula is a triangular bone. So we're going to start the sketch by drawing a triangle. And I'm going to start with a vertical line like so. This will be the medial border of the scapula, which sits closest to the vertebra and is parallel to the vertebra. Then we're going to draw the second side of our triangle, like so. This will be the superior border of the scapula, and then connecting the two lines we'll get our triangle. So this is the basic structure of the scapula. Now I'm going to be drawing this looking at the bone from its posterior surface, which is its superficial surface, since this is a bone that's on our back. And as I said, the spines of the vertebra are over here. Now, the scapula is going to articulate with the humerus. And to do so, it needs a articular surface, a flat surface that's slightly concave, and that will be on the lateral edge here. So if we just take and draw a slight depression here on the lateral edge, and then to complete the drawing we need to erase the point we had out here on the initial triangle. So like so. And this will be the glenoid. So the glenoid is right there, and that would be the lateral angle of the scapula, except the angle is cut off. The other angles need to be rounded off. They're not pointy like this. So again, what we'll do is round off the superior angle, and the inferior angle. After I get the rounded parts drawn in will erase the pointy parts. Now that I've got the angles rounded off, let's put in the labels here. All triangles have 3 angles, and we mentioned the lateral angle becomes the articular surface for articulating with the humerus, the glenoid, and we've just rounded off the superior angle. And the superior angle, we'll draw a line to connect the label to the structure. And then down on the inferior aspect of the bone, we have the inferior angle, and again we'll connect a line to that structure like so. We also have 3 sides to any triangle. We will have a lateral border, the lateral border is the lateral edge of the triangle, the one to the side, the furthest to the side. We will have a medial border, and the medial border is sometimes called the vertebral border of the scapula because it is the closest to the vertebra and parallel to them. And then we have a superior border, and the superior border will connect a line to here. So a basic triangle. The scapula has 2 principal projections from it, and one is actually on the anterior surface, but you can see it in this view. At least you can partially see it. And that is a structure called the Coracoid Process. So let me sketch in here. Coracoid Process. And the Coracoid Process looks a little bit like a bent finger. Now remember, this is actually projecting anteriorly, in other words, into the screen, into the drawing, away from our point of view. And like most processes, the coracoid process is there for muscles to attach to. So we'll get a label here. The Coracoid process. And we're going to find that in the superior border there will be a notch, a little cutout. And again, I need to get the eraser out here to erase away the previously drawn edge. And that little notch is called the suprascapular notch. The suprascapular notch. And again, we'll draw a line in to get the to point out the structure. So suprascapular notch. Suprascapular notch is there to transmit an artery, a vein, and a nerve. Now, a prominent structure on the posterior of the scapula is the spine and the spine's expanded area laterally, the acromion. Let me sketch in the spine and acromion here. The spine and acromion. And again, this is on the posterior surface, so the spine and acromion, where it passes over the edge of the glenoid, is going to make the glenoid invisible to us. It'll cover up. So we have the spine, which is the part over the major body of the bone. So there's the spine. The acromion also called the Acromion process, is this expanded continuation of the spine. Now, as we look at the posterior view of the scapula, we'll see that there are two areas that, because the spine grows up from the surface of the scapula, breaks the posterior surface into two areas that have a slight depression. So they're called fossa. And we have one that is on the superior side of the spine, and that is called the Supraspinous Fossa. And that would be this area between the spine and the superior border. And then the area inferior to the spine, the infraspinous fossa. And the infraspinous fossa would be this area below the spine, all the way down to the inferior angle. Now, if you look at the edges of a bone, you'll see that the edge is slightly thicker, so that this area in here actually is a slight depression, and all fossae are depressions. Same is true up here, although this one looks more like a fossa because it is so close to the spine that it looks like a nice depression in here. The supraspinous and infraspinous fossae are both areas of muscle attachment. If you look at the anterior surface of the scapula, the only prominent feature is the coracoid process, which, remember, projects anteriorly, and the entire anterior surface of the scapula is smooth. It's actually riding on the rib cage. And that area would be called the subscapular fossa. And the subscapular fossa, as I said, is on the anterior side, so not seen. So it's not seen in this view. And the subscapular fossa will also serve as an area of muscle attachment. Now, the scapula articulates with the clavicle at the acromion. And it articulates with the humerus at the glenoid. But it does not attach to any of the axial skeleton at all. So in the next slide, I want to show you how the scapula is held onto the body. Now, in this slide, I've redrawn the scapula. And the scapula is a bone that essentially floats over the rib cage. It slides over the rib cage and is held onto the body by muscles. Now, what I'm going to do is put a center of gravity on the scapula, or center of where all the muscles will act. And we'll put that right about in that position, that nice dot. And then we'll draw some arrows to indicate the way muscles pull on this bone. So if I take and draw an arrow from our dot superiorly and put the heads on the arrow, the muscle that pulls in this direction is the muscle trapezius. Now, trapezius is a large muscle and it pulls in a lot of different directions. But this is the primary muscle that's pulling the scapula directly up, directly superiorly. We have some other muscles pulling the scapula medially and slightly superiorly. And these muscles are a pair of muscles called the rhomboids, rhomboid major and rhomboid minor, and our old friend trapezius. So they're pulling medially and slightly superiorly. Now, muscle pulling medially and inferiorly is Latissimus Dorsi. Now, Latissimus Dorsi's action, when you read it in the textbook, is going to be on the humerus primarily, but it does have fibers attaching to the inferior border of the scapula, and it can and does pull the scapula medially and inferiorly. Latissimus Dorsi. Let me move the label a little bit closer to the arrow. Then pulling inferiorly and laterally is the Pectoralis Minor. Pectoralis Minor muscle. Now this muscle actually attaches to the coracoid, but its action is to pull the scapula laterally and inferiorly. And then we have a muscle that we find on the chest, serratus anterior. And serratus anterior originates from the anterior surface of the thorax, from the rib cage, but it inserts on the medial border of the scapula. So it wraps around the rib cage to attach on the medial surface of the scapula, right here. So serratus anterior pulls the scapula laterally. Now these muscles all act together so that the scapula moves in all of these directions. And as I said, it floats on the surface of the rib cage. So it will slide laterally and forward, because the rib cage is rounded, and then it will slide back medially and posterior. And these muscles actually hold the scapula onto the body. Now I should add that assisting trapezius is another muscle, levator scapulae, but it pulls right here at the edge, and it does elevate, but it more rotates the scapula so that the glenoid tends to look inferiorly. These are the muscles that control the way the scapula slides over the rib cage and actually holds it onto the body. In the next video, I will talk about the bone of the arm, the humerus. Thank you for your attention.